Hi, Caitlin. My name is Kayla, and I'm an occupational therapist that's here to work with you today. How are you?
Good, how are you?
Good. I understand you're having what we call lateral epicondylitis, so you're having pain around your elbow joint. You're experiencing a lot of pain, especially when you're picking up heavier objects, trying to cook, and just clean around the house. Is that correct?
Mm-hmm.
Okay, so what I'm here today to do is I'm going to go over what we call a home exercise program or a plan. So what I'm going to teach you how to do is use what we call a modality that's going to help hopefully decrease that pain, get you being able to move a little bit more, being able to do your activities around the house that you still need to do. So that is the ultimate goal. I'm going to teach you how to use this so at home you can use it by yourself. You don't need to come into the clinic to get this done. Does that sound like something you'd be okay with?
Mm-hmm.
Okay, so first of all, if you want to go ahead and put your left arm up. And since we are just in a flare-up and this is just an acute phase, we are going to do this modality. That's why it's chosen. And you're in the acute phase, so we will just do sensory today. What this means is that when I put this unit on you, you're just going to feel a strong but tingling sensation. You shouldn't feel anything past that. Okay?
Okay.
So before I even go farther, I want to just make sure that this is the appropriate modality for you. So I want to ask you a few questions. Are you pregnant?
Mm-mm.
No. Have you had any cardiac problems, cancer, any blood vessel issue, anything like that? Any decreased numbness or sensation that you know of?
Mm-mm.
Okay. I will do a test in just a second. Do you have any history of any seizures?
No.
Nope. And no pacemaker, correct?
No.
Okay. So if you want to go ahead, and I'll go ahead and do that sensation test. So put both of your hands up here for me. What I'm going to do is I'm going to have you close your eyes. I'm going to touch you in a few different places, and when you feel me touch, you just say yes.
Okay.
And then I'm going to ask you, I'm going to touch both areas, and I'm going to say, does it feel the same? And you'll just let me know.
Okay.
Okay, so go ahead and close your eyes. So,
Mm-hmm.
okay.
Mm-hmm.
Does it feel the same?
Yes. Mm-hmm. Mm-hmm. Yes.
Okay, perfect. And your skin looks really good, obviously, as you are in a flare-up, so there might be a little redness and stuff, but other than that, it looks good. Okay, so like I have provided this handout, before we go into this, I have provided this handout. There's going to be a few steps, and you can look at the handout as well as follow along with me when I go through this. But this will be for you, and this is something you can look at every day to make sure you're doing it correctly. So if you want to go put that left arm back up. So the first thing we want to do, we just want to clean your skin. So I'll provide you just a little bit of alcohol. You just rub on the area. So I'm going to go ahead. You just want to rub it over the area. You're going to place what we call electrodes. We just want to make sure they're going to stick and you're free of any dirt and clean. So then we're going to place what we call your electrodes. So when you're putting them on you, you want to make sure you pick them up from a corner and not the wire, because we don't want the wire to come off. You want to make sure one is placed above the elbow, and then we're going to go ahead and place the second one below that elbow. We do want to make sure when we're placing them, there's at least enough room that you could fit another pad in between if you needed to. This is going to give us the best system through there. Okay, so what we're going to do now is we have this, what we call, it's plugged into channel 1, so that's going to be the hole on the left. So you want to make sure you're plugged in that and make sure it's secured in there. Then you're going to take both of these lead wires. It doesn't matter which one goes into what, but you're going to just go ahead and pop that into each one. Make sure they're secure and not falling out. Okay?
Mm-hmm.
And you are comfortable right now? Okay. So we're going to head, and like I said, you are in the acute stage, so we're just going to do sensory, and that's just a strong but comfortable tingle. You shouldn't feel anything as of right now. I'll let you know when we will begin. Okay? So what you're first going to do is, to make sure everything's plugged in, you're going to just turn the device on. After you've gone to the device on, we just want to go to mode until you see the TENS in. The TENS in is for the sensory, so we want to make sure we're definitely on that one. Then we're going to go ahead and go to the set button and go down to where we see rate. And then between rate, we want 80 to 100 is your parameters. So since just starting out, we'll go ahead and just set you at 80 to begin with. And then we're going to hit set again until we come up to the width. Now the width can be 50 to 100, but we're going to go ahead and set you at 70 because that's a good medium. And like I said, this is something that you can control as long as you stay in those parameters. You can go up and down what you like. And then we're going to go to the bottom and we're going to hit this time button. Now the time can be, what we suggest is 15 to 20 minutes. However, since this is the first time, you might not be able to handle it for 15 minutes. So if that's the case, you just hit the off button and it should stop. It's okay if you can't last 15 minutes, and then when you keep doing this, eventually you will be able to progress up to that time. Okay, so lastly, we have the intensity. The intensity, there's no start button, so when you start hitting up on the intensity, you should automatically start feeling something. So, like I said, you want to hit it until you feel a strong but comfortable tingle. You don't want to go where your muscles are jumping or anything like that. You just want it to be a tingle. Okay, so I'm going to go ahead and start hitting it up, and you just let me know first when you feel it, okay?
I feel it.
Okay, so should I stop now, or could I go
You can keep going.
Okay, just let me know.
That's good.
That's good? You feel that comfortable but strong tingle. Okay, so like I said, you want to keep this on for 15-20 minutes is recommended, but once again, if you do not feel comfortable, if this doesn't, you feel like it's not feeling how it should or anything like that, the off button is right there. And after this is done, just because this is reducing your pain, however, this doesn't mean you should, push it to the limit and go pick up something heavy. You want to try to preserve what you do have in this arm and maybe use your other arm for doing those heavier tasks so you're not, bringing it back into more pain again. So do you have any questions so far? Okay. And this is the handout I provided with you, like I said, step by steps. Also has my name and my phone number on the top if you have any questions. Like I said, if you feel anything that you think is uncomfortable or anything like that, just stop doing it and give me a phone call and we'll figure out what's going on.
Okay.
Does that sound like okay?
Mm-hmm.
Okay, perfect. Thank you.
Mm-hmm.